This is my audience. Ready?
Yes, ma'am.
Hi, my name's Marissa. I'm going to be talking to you about the rotavirus. I'm going to change the next slide. So, what is the rotavirus? Well, when you look in a microscope, the rotavirus is a round shape. It has these little pong-looking things on it. It actually gets its name from a Latin word. The beginning of the word rota is Latin, which it means wheel in Latin. So, and the virus is easily spread. It causes inflammation in your stomach and your intestines. And usually people get it between late winter and early spring. And it causes diarrhea and vomiting and everything else, which I'll go into detail later. Next. Most likely to get this virus is infants, young children, close relatives like parents that are taking care of these sick children, those who work with the children, teachers, healthcare employees are most likely to be infected. How do you get it? Well, when a child has rotavirus, it is presented in their poop. So when they go to use the restroom, they don't properly wipe, or they get it on their hands somehow, or babies, they dig in their diapers, and they touch everything else around them. So countertops, toys, everything. That's how it can be spread. And if they don't properly wash their hands after using the toilet or washing your hands in general, it's easy to spread the infection, the virus. Go stand over there with Daddy. I'm gonna give you a bubble. Go.
Come here, Mama. Here.
Hurry. Daddy's gonna give you his phone. So that's how, and if you don't wash your hands, and if you put the objects that they have already touched near your mouth, then you also can be infected as well. Symptoms, children that are exposed to the virus don't show symptoms up to 2 days. Once it starts, they can have a fever, they'll start vomiting, stomach pains, fades, and well, that all fades when the diarrhea starts.
Rosalie.
Diarrhea can last up to 5 to 7 days, and adults they have similar symptoms, but not as severe as young children or babies. Well, vomiting and diarrhea, child may not be able to eat or drink, which can cause dehydration, which is another symptom caused due to all of the vomiting and the diarrhea. When to call the doctor.
Doctor? What doctor?
Rosalie, that's enough. When to call the doctor when they're not able to drink fluids, or their fluid intake is less than what it should be. Their diapers are dry, they're not outputting urine anymore. If they have stools that are black or have blood in them, temperature in a baby, if they're 6 months or younger, if they have any temperature higher than 101.5. And for children that are older than 6 months, if a temperature more than 24 hours is ongoing. Like I said, with vomiting and diarrhea can cause dehydration and can be life-threatening and requires being put in the hospital so you can be, they can get fluids. Next. This is just an ongoing of the dehydration symptoms from vomiting and diarrhea. Crying with no tears can be a sign. Peeing to little pee to dry diapers. Dizziness, pale skin, and sunken in eyes can all be signs of dehydration.
Mommy.
Diagnosis and treatment. Doctors will do a physical exam and a lab analysis of a sample of the child's stool or the infected person's stool, which will determine if they have rotavirus. Treatments, there really isn't treatment plan for it. The antibiotics don't work and antiviral drugs do not work, but you can get medication for the other symptoms, as in for vomiting or diarrhea. Maybe they can give you something for that. At home care, you drink plenty of water, fluids, clear fluids, broth, eat crackers, saltine crackers, do not eat, cheese, sugary foods, or anything that will upset your stomach, milk. And that's it. Next. Rosalie, go sit back there and do it. Hurry. Prevention, wash your hands. Wash your hands is probably the #1 thing to stop the virus from spreading. Wash your hands and disinfect your countertops, your area your children play in. The CDC recommends that your child gets vaccinated. They have 2 times that they will get vaccinated between. She's given in 3 doses at ages 2, 4, and 6 months of age, and then there's another one that is given 2 doses at 2 months and 4 months of age, and this will help with their symptoms if they are to get infected. It will be less likely for them to be severe symptoms.